Before we start the video, I'd like to talk a little about myself today. Personally, I come from a family with slightly high cholesterol. I also have relatives with high blood sugar, so I believe there's a family risk of diabetes as well. Since I'm sharing this information myself, I try to be careful with sweets and fatty foods, but my cholesterol just wouldn't go down. I've had that experience. I think many of you watching this video are also careful with your diet, but still wonder why your cholesterol or blood sugar levels aren't going down. If that's the case, there's one thing I want to tell you, that is never. It's not necessarily because you're not trying hard enough. Of course, diet and exercise are important, but genetics is also a factor that can't be ignored. So first, please stop blaming yourself. No matter how hard you try with your diet, things like blood sugar and cholesterol can go up due to hormone balance and other factors. Because lifestyle diseases are often featured on television, it's easy to blame yourself and think it's because you're careless, but those kinds of... Please don't forget that there are genetic factors, hormones, and age involved. And just by being interested in your health and watching this video, I think you're already one step ahead compared to people who aren't interested in videos like this. However, you don't need to give up just because it's genetic. Of course, with diet, exercise, and the things I'll share with you today, I believe your numbers will go down, so please try to find at least one thing that you feel you can stick with or incorporate into your daily life. I'm sure that your worries will turn into hope for the future through today's video. It's going to be a long video, but please watch until the end. At YouTube Medical University, we share easy to understand and data-based videos from the perspective of practicing doctors. If you want to start being healthier from tomorrow, I'd be happy if you subscribe to the channel. So today's video is going to be a bit long, but we'll go through it in 5 parts. In the first part, I'll briefly and clearly explain what cholesterol actually is. Then, in the second, third, and fourth parts, I'll introduce foods that lower cholesterol in the second part, fruits in the third part, and drinks in the fourth part, dividing them by category. And in the fifth part, I'll wrap things up and share some important points, so please stay tuned until the end. Now let's get started with the first part. I'll briefly explain what cholesterol actually is. Cholesterol isn't something that should just be lowered as much as possible. The reason is that our bodies are made up of cells, and the membranes of these cells are actually made of lipids, or fats. That's not all. Things like female hormones and male hormones, thyroid hormones, and hormones in the brain. Many of these neurotransmitters in the brain are actually made from fats and lipids as well. This gives the impression that triglycerides and cholesterol must be lowered, but not having enough can also be an issue. That's what people say. Low-density lipoprotein cholesterol, which is often called the bad cholesterol. If this really were bad like people say, it should have been eliminated through human evolution, right? The fact that it hasn't been eliminated and still exists means it actually has a role. Low-density lipoprotein cholesterol is what carries cholesterol made in the liver to the peripheral organs of the body. Thanks to this, cholesterol is delivered to the peripheral areas and becomes the material for building cells. In other words, low-density lipoprotein is like a delivery man, and high-density lipoprotein, which is called the good cholesterol, is like a cleaner. High-density lipoprotein cholesterol is what brings excess cholesterol that has been delivered throughout the body back to the liver. So, when there is excess fat in the blood vessels, it sticks to and deposits on the walls of the vessels, which causes arteriosclerosis, making the blood vessels hard and leading to plaque buildup. To prevent this from happening, high-density lipoprotein returns the fat in the blood vessels to the liver, which is why it's called the good cholesterol. Now, what about triglycerides? You might think they're bad, but that's not actually the case. It's like carrying extra gasoline in a car. The history of humanity has been a struggle against starvation. In the past, we lived as hunter-gatherers, surviving by hunting. There were days when we couldn't find any food, but fortunately, there were also times when we succeeded in hunting and could eat a lot of meat or a large amount of food. At times like these, we needed to store energy in our bodies, and the most efficient way to do that was with fat. Since the number of grams per calorie is low, it can be densely stored in the body. If your body isn't light, you can't go on the next hunt, right? So it's stored in the most cost-effective way in the body. This is what we call neutral fat. A little of it is fine, but if your neutral fat gets too high, it's said that it actually makes the cholesterol delivery agent called low-density lipoprotein cholesterol smaller. The smaller low-density lipoprotein cholesterol can more easily get into the walls of blood vessels, which is now believed to further accelerate arteriosclerosis. That's all for today's lecture. Cholesterol isn't necessarily a bad thing, but if you have too much of it, it can cause fat to build up in your blood vessels and organs, which can lead to arteriosclerosis. So starting from the second lecture, I'll talk about the foods, drinks, and fruits that you've been waiting for, which can help lower cholesterol. First, in the second lecture, we'll discuss food. So far at YouTube Medical University, we've presented many meals that lower cholesterol. I've already explained about mackerel, nuts, and soybeans in the past, so if you're interested, please check the description below or the card at the top right after this. When it comes to cholesterol, the 3 foods I just mentioned are extremely effective. However, this time I'll introduce 3 other foods that are getting attention. The first of the 3 foods that help lower cholesterol is eggs. Some of you might think that eggs aren't good for cholesterol, and of course that's true. Eating too many eggs might lead to excessive cholesterol intake. However, the belief that you should only eat 1 egg a day because eggs are high in cholesterol is just a myth. Have you ever heard that? Actually, that's not true, and that's what I want to tell you, so I started by introducing eggs. This itself doesn't lower cholesterol, so please don't misunderstand that. I always get asked in YouTube comments, is it true that you should only eat 1 egg a day because eggs raise cholesterol? To give you the conclusion first, that's not the case. In the past, people used to say that eggs, especially the yolk, were bad because they contain a lot of cholesterol. But recent studies have shown that the cholesterol you get from food, most cholesterol is made by the liver, not mainly from other sources. It's been found that about 80% of the cholesterol in your blood is actually produced by your liver, so it's believed that the impact from your diet isn't that significant. In 2020, an article was published in a prestigious medical journal called Journal of the American Medical Association. According to an American study that analyzed data from over 170,000 people for generally healthy individuals, even if you eat 1 egg a day continuously, the results showed that there was no association with an increased risk of future heart and blood vessel diseases. And in the recommendations of various countries, there are basically no guidelines that limit eggs to 1 per day. I also had a patient like this in my clinic. She was a woman who was told during a health checkup that her cholesterol was high. Because she didn't want her cholesterol to go up any further, she avoided eggs and lived that way for several years, but her cholesterol didn't go down easily. When I asked about her eating habits, it turned out she actually didn't like meat or fish. The only source of protein she had was basically soybeans. On top of that, since she had also cut out eggs, she wasn't getting enough protein, and in fact, she tended to rely on things like rice, foods high in fat, cheese, and other dairy products. As a result, her muscle mass decreased and she gained weight. That was her situation. Losing muscle mass lowers your metabolism, making weight gain easier. In fact, I had that person eat 1 egg a day to see if their cholesterol would actually go up. As a result, there was absolutely no problem even after eating them. In fact, eggs are called a complete nutritional food, containing vitamins and nutrients that the body can't produce on its own. They are rich in essential amino acids and protein. I myself often eat 2 or 3 eggs a day. Rather than avoiding eggs out of fear of cholesterol, I think it's better to eat them for their nutritional value. Of course, people who already have very high cholesterol or have hereditary high cholesterol should be careful, so please consult your doctor and consider it carefully. I think it's much better for your cholesterol to reduce the fatty parts of meat rather than cutting back on eggs, so please consider that. Lowering cholesterol. The second of the top 3 foods is seaweed. Seaweed is actually getting a lot of attention right now. What you should especially pay attention to are the sticky types of seaweed. Mozuku contains fucoidan, which is found in mozuku, and alginic acid, which is the slimy component in kelp. These sticky components are characteristics of soluble dietary fiber. Soluble meaning they dissolve in water. This is a type of dietary fiber. Soluble dietary fiber firmly captures the cholesterol you take in when you eat rice, and it is expected to help expel it from your body along with your stool. In a study conducted back in 1999, according to a relatively reliable analysis called a meta-analysis, it was found that taking 1 gram of soluble dietary fiber per day led to a 1-point decrease in low-density lipoprotein cholesterol. And furthermore, in a study conducted in 2023, similarly, in another highly reliable study called a meta-analysis, it was found that increasing soluble dietary fiber to 5 grams per day resulted in about a 5-point decrease in low-density lipoprotein cholesterol. So, adding plenty of wakame seaweed to your miso soup or eating just 1 pack of mozuku vinegar a day may also be effective in lowering cholesterol. However, since wakame and similar seaweeds contain a lot of iodine, please be careful if you have thyroid problems. The third food that helps lower cholesterol is mushrooms. Mushrooms, like seaweed, are champions when it comes to dietary fiber. Are you familiar with beta-glucan, a type of soluble dietary fiber found in mushrooms? This is also expected to help lower low-density lipoprotein lipoprotein cholesterol. Several meta-analyses have reported that consuming more than 3 grams of beta-glucan from mushrooms per day is associated with about a 5 to 7% reduction in low-density lipoprotein cholesterol. If you think mushrooms are a bit of a hassle to cook, let me share my recommended recipe. This is a pretty lazy meal, but it's steamed maitake and shimeji mushrooms in the microwave. It's really easy to prepare. Wash the maitake and shimeji mushrooms you bought at the supermarket and put them on a plate. Then drizzle a little cooking sake over them, loosely cover with plastic wrap, and microwave for about 2 minutes. That way the mushrooms are cooked just right and any unpleasant smell is gone. I like to pour a bit of ponzu sauce over them and eat the mushrooms just as they are. They're also delicious with olive oil and salt and pepper. It's really convenient when you want one more dish or don't have much time, so please try microwaving mushrooms. Mushrooms are low in calories, high in dietary fiber, and rich in vitamin D, which helps strengthen your bones. You can use any kind of mushroom. Eringi, maitake, or shimeji are all fine. Please try to actively include them in your daily meals. So, in this second period, I introduced 3 foods that help lower cholesterol. The first one doesn't actually lower it, but you don't need to be too afraid of eggs. The second is seaweed, and the third is mushrooms. Please make a note in the comments so you don't forget. Next, let's begin the third period, the fruit section. For those of you who love fruit and just can't help but want to eat it, but are also concerned about cholesterol, I've carefully selected fruits that may have a positive effect on cholesterol. Please listen closely. First, let me give you one piece of advice. When it comes to fruit, try to eat the whole fruit rather than drinking fruit juice. According to a 2013 study published in the British Medical Journal, people who ate fresh fruit had a lower risk of diabetes, while those who drank fruit juice actually had a higher risk. The sugar called fructose found in fruit is absorbed quickly. So when fruit is turned into juice, you can drink it all at once, which causes your blood sugar to spike rapidly. However, when you eat fruit as it is, you peel it and chew it, so the absorption tends to be slower. You also don't lose any dietary fiber. Please remember to eat fruit raw whenever possible. Here are 3 fruits that are good for cholesterol. The first one is this: apple. Apples actually contain something called soluble dietary fiber, pectin, which I mentioned earlier. As I mentioned in the second session, this pectin is believed to firmly bind to cholesterol and help eliminate it from the body. According to a review that summarized several studies, taking 3 to 6 grams of pectin per day, which is about half to 1 apple, was associated with a 6 to 10% reduction in cholesterol. That's a promising number, isn't it? And actually, pectin is mostly found in the skin of apples. So when you eat apples, make sure to wash them well and eat them with the skin on. Fruits that are good for cholesterol. The second of the top 3 is blueberries. If I had to choose just one fruit, I would recommend blueberries. In fact, it is expected that they may also have a beneficial effect on cholesterol. Blueberries are known for their antioxidant properties. It's a substance called anthocyanin, which is also famous from commercials. Actually, low-density lipoprotein cholesterol can become oxidized. Oxidized low-density lipoprotein cholesterol is harmful and is said to damage blood vessels, but anthocyanin, which is found in blueberries, is expected to help prevent this oxidation. It was reported in an American journal in 2021. In the study, 120 patients with dyslipidemia and high cholesterol were divided into a group that took 320 mg of anthocyanin per day and a group that took a placebo. When comparing the groups, those who took anthocyanin, in just 12 weeks, the group taking anthocyanin saw their bad cholesterol decrease by about 13%, while their good cholesterol increased by the same 13%. In fact, blueberries are also expected to be effective for diabetes. As I mentioned earlier, there was a study in the United States in 2013 that tracked 180,000 people. Even in this massive dataset, people who regularly ate blueberries had about a 26% lower risk of developing type 2 diabetes compared to those who didn't eat them. It's said that the nutritional value doesn't really change even if you freeze them, so why not try storing them frozen for a long time and putting them on yogurt as a snack? Here are the third fruits that are good for cholesterol: kiwi and banana. While there isn't data showing that these lower cholesterol, there isn't much data, but from the perspective of arteriosclerosis, in other words, not just cholesterol but also considering blood pressure and blood sugar levels overall, I included these 2 fruits in the ranking. Kiwi is rich in dietary fiber, Bananas are rich in potassium, and there are reports that potassium intake may actually reduce the risk of future strokes, such as cerebral hemorrhage and cerebral infarction. Let me give you one caution about fruit. That is grapefruit. For people taking cholesterol-lowering medications called statins or blood pressure-lowering medications, taking some of these drugs together with grapefruit can block the breakdown of the medication. There are some medications for which there is a risk that the drug may become too effective. Especially with statins, it is said that taking them together with grapefruit may increase the risk of a serious complication called rhabdomyolysis. So, if you are taking any kind of medication, please be especially careful with grapefruit among fruits. For more details, please consult your doctor or your pharmacist. I've made a video in the past about the serious complications caused by statins, so please check it out if you're interested. How was it? We finished the third period. In the third period, I mainly introduced apples and blueberries as fruits that are good for cholesterol. If you're concerned about your cholesterol, try eating apples with the skin on and frozen blueberries as a snack. At YouTube Medical University, we offer simple videos from doctors who diagnose and treat lipid disorders, helping you get healthier starting tomorrow. And what can you do to avoid getting sick in the first place? We also share information about preventive medicine. I'd be happy if you subscribe to the channel so you don't miss any new videos. In the fourth period, I'll introduce drinks that can benefit cholesterol. Please learn about them and try to add them to your daily routine. Please take another look at the drinks you consume. I often talk in my videos about drinks that aren't good for you, such as sweet juices, cafe au lait with lots of sugar, and sports drinks. I've talked many times before about why these are bad. According to a 2009 study published in the Journal of Clinical Investigation, people who drank sweet beverages containing fructose showed increased synthesis of fat and triglycerides in the liver. If you like these kinds of drinks, just switching to the 3 drinks I'm about to introduce can help lower your cholesterol, so please listen carefully. Here are 3 drinks that are good for cholesterol. The first one is green tea. If you're Japanese, you probably like green tea. Green tea contains catechin, like the anthocyanin I mentioned earlier, is also an antioxidant. According to a meta-analysis conducted in 2011 that combined 20 studies, it was reported that consuming green tea or its extracts lowered total cholesterol and bad cholesterol by an average of about 5.3. It might seem like a small amount, but just switching your usual drink to green tea can help lower your cholesterol. The second drink that's good for cholesterol is coffee. I also love coffee and drink 2 to 3 cups a day. As long as you don't drink too much, coffee can also be good for your health. In the past, I've mentioned that it might also be effective in preventing fatty liver and liver cirrhosis. Actually, it's also believed that coffee may be effective for cholesterol as well. The reason it's effective is because coffee contains an antioxidant called chlorogenic acid. It's said that this may be effective in preventing the oxidation of low-density lipoprotein cholesterol. However, please be a little careful about how you drink coffee. The recommended way is to brew it using a paper filter. For example, if you use a French press, it doesn't go through a paper filter, so a component called cafestol remains. This component is said to possibly raise cholesterol, so to remove such substances, I recommend using a paper filter. Of course, I recommend drinking black coffee, not sweetened coffee. The third drink that's good for cholesterol is this one, apple cider vinegar. I introduced this in my book before, and while the effect might be slight, this apple cider vinegar, it's mainly widely sold overseas, but research reports suggest that taking this can have a slight effect in reducing body weight, blood sugar, and triglycerides, so it's currently getting a lot of attention. There are even reports that low-density lipoprotein cholesterol dropped dramatically. It's not that I absolutely recommend everyone drink this, but personally, mixing apple cider vinegar with sparkling water is refreshing for me, and since it tastes good, I sometimes suggest replacing juice with something like this. Please give it a try if you're interested. What did you think? As for drinks that may have a positive effect on cholesterol, green tea, I've introduced coffee, apple cider vinegar, and apple vinegar. If you found any of this interesting or helpful, please hit the like button or leave a comment, even just a word. It really motivates me to make more videos. Now lastly, let me talk about the most important thing in this 5th section. This time I introduced meals that are easy to improve, but actually there is something that can completely ruin all the effort you put into these meals. What if you have habits like that? So, to wrap up, I'll talk about an even more important foundation, your lifestyle habits, and then finish this video. To get straight to the point, it's stress, exercise, smoking, and alcohol. Stress is something that's easy to overlook, but when you're feeling irritated or tired, Don't you ever find yourself craving sweets or overeating for no reason? Strong stress can disrupt your hormonal balance, which can cause your appetite to explode, making it hard to control yourself and leading you to overeat. Even though it's difficult to simply reduce stress when people tell you to, as I mentioned today, if you work hard to lower your cholesterol but don't enjoy life, it defeats the purpose. It's important to let yourself enjoy your favorite foods occasionally, like once a week or with a monthly cheat day, where you can eat anything you want and give yourself some nourishment for your soul. Even though, as a doctor, I always talk about correct health information, please also make sure to value your happiness and avoid building up stress. And exercise is also important when it comes to lowering cholesterol. Especially aerobic exercise, the kind that makes you a little out of breath, is said to be effective. There isn't a lot of solid data yet on whether exercise actually lowers low-density lipoprotein, but exercise is expected to help lower triglycerides and raise good cholesterol. The 2018 American Physical Activity Guidelines state that even short bouts of exercise under 10 minutes can have health benefits. For those who think they can't keep up with exercise, even 5 or 10 minutes is fine, so let's start with a little. And as for alcohol and tobacco, it's obvious, isn't it? Alcohol raises triglycerides, and tobacco increases oxidative stress and oxidizes low-density lipoprotein cholesterol, which accelerates arteriosclerosis. There is solid data to support this. If it causes stress, it defeats the purpose, so try taking one day off from drinking, or have candy or gum once a day instead of smoking. I recommend starting with small improvements. If you have any habits that you are conscious of for your cholesterol, please let me know in the comments. I think it will be helpful for others and will raise the overall health level of the channel. How was it? This time I introduced foods, fruits and drinks that lower cholesterol. Here at YouTube Medical University, we provide data-based information from the perspective of an active doctor. It's important to have a reliable source of information. We are aiming for 1 million channel subscribers. If you like, please subscribe to the channel. See you in the next video. As a general practitioner, my patients have shown me how to age gracefully from your 70s on. I want to live this way too. I never knew it was possible. These stories share lessons I've learned from many patients, like whether chatting with friends is more valuable than exercise, or that in medicine, less can be more. These are insights from my elders. It's filled with wisdom on how to live healthily and happily no matter how old you are. Please check it out from the description below.